Hello, ma'am. Why am I having series of miscarriages? Each time I become pregnant, I miscarriages. What is the causes? And what can I do to stop having miscarriages? Welcome. My name is Tochi and you are watching Tochi Fertility Channel. In this video, I am going to explain to you the causes of miscarriage. I have this question, many of them coming from most of the women who become pregnant, and at the end of the day or end of the month, they lost the pregnancy. Now, they want to find out why they are having these miscarriages or the causes of the miscarriage. If you think this video is for you, watch it. This is what we are going to be discussing. Now, let us look at this. What is miscarriage? What does it mean for somebody to miscarriage a baby? Miscarriage is the spontaneous loss of a pregnancy before the 20th week. This happens in most of the women. And sometimes the funny thing is that when you go for a test, you cannot be able to, identify the causes or the reason why you keep on having series of miscarriages. And that is why most of the women are inquisitive to know, so that they can take precaution and also to avoid those things that made them to have miscarriage. What is the causes of this miscarriage? We are going to take it gradually. We are going to look into it. I made a comprehensive research about this. I'm going to take this more to explain so that even a layman watching me will understand. Number one causes of miscarriage is the problem with genes or chromosomes. Most miscarriages occur because the fetus isn't developing as expected. When the newly fertilized zygote or the baby, let me be using the word baby, when the baby is not developing very well, you will experience miscarriage. Let's look at the chromosome problem that can lead to you having a miscarriage. Number one is blighted ovum. Somebody asked me this question yesterday in my live video, and I told the person that I'm going to be making video about this. The number one is blighted ovum. This occurs when no embryo forms. This type occurs when no embryo forms. Some of you might conduct tests with pregnancy tests, and it will show you positive, and when you go to a scan, they will tell you that they are not seeing anything. What they are seeing is blighted ovum. This means that no embryo is forming, and this would be as a result of chromosomes problem. Intrauterine fetal dismiss. In this situation, an embryo forms but stops developing and dies before any symptoms of pregnancy loss. The number two is intrauterine fetal demise. In this situation, an embryo forms. Here, the embryo forms but stops developing and dies before any symptom of pregnancy loss. So the embryo will be forming. At the stage, it will stop forming and it will die. After the death, then you will start feeling symptoms of miscarriage. This blighted ovum and intrauterine fetal dismiss happens as a result of chromosomes problem. Now, the number two causes of miscarriage is maternal health condition. When you have a health condition, that is why I always tell women who are trying to conceive to make sure to endeavor that they undergo medical checkup to find out. I keep on saying it. Some people are so eager to become pregnant. Oh, what can I take to become pregnant? But they haven't checked their system, if their system can carry pregnancy, especially if you are if you are up to 35 to 40 years. You need to check your body overall health to ensure that you can be able to carry pregnancy, because pregnancy is not it's not an easy thing. When you have health issues and you become pregnant, you are going to be in pain. It will be unbearable for you. Maternal health conditions such as uncontrolled diabetes, infection, hormonal problems, thyroid disorder. All these things can lead to miscarriages. For example, when you have hypothyroidism, that means that your thyroid gland is underactive, is not functioning very well, and when this usually happens, it slows down your entire system. Okay, let's assume that you are pregnant now and you have this hypothyroidism now. It means that your whole system will be slow. Everything will not be functioning properly and it will affect the baby. Yes. So have yourself checked. It's not all about getting pregnant. Do not go and become pregnant to suffer the innocent baby, but rather check yourself. If you have infection, of course, infection can make you to have miscarriage. If you have hormonal problems, it can lead to miscarriage. Please, my sister, I am not here to, I am not here to deceive you, but rather I am here to tell you something that you can do that will help. You need to be prepared. That is why I like the Western countries. In Western countries, once they want to become pregnant, they will first of all undergo medical check to find out if their body is good, whether if they are healthy, especially those of us that are 40. You need to do this. In the next video, I am going to teach you how you can prevent miscarriages. Another thing, I just mentioned these things. I just mentioned them together. When you have low progesterone can also lead to miscarriages. Progesterone is the hormone that protects your pregnancy. It's just like you having a bodyguard, somebody that protects you. When the person leaves you, you are now prone to danger, right? So that is the work of progesterone. Immediately the HCG dictates that you are pregnant, your body will be signaled to produce the hormone called progesterone. And the duty of this progesterone is to protect the baby until after 3 to 6 months, when the baby will start producing their own progesterone. So when you have low progesterone, you are likely, not even likely, you will have a miscarriage. I just put them under hormonal disorder. So my dear sister, the best solution here is, before you become pregnant, make sure that you undergo test to ensure that all your system, they are intact, that all your system is functioning properly, that your body is ready for conception. Do not, just because you want to be pregnant, you can do anything. Of course, you become pregnant. What comes after? Are you going to be happy with the pregnancy? Will you carry the pregnancy to the end? This is the question you should ask yourself as you are watching me. I know many people, they have series of miscarriages, but they don't know. They think it's a human being that is doing them. They think that some people have eaten winch to them. No, you are the one causing your problems because you didn't find out the issues that you have. It's just like somebody who have a uterine fibroid or submucosal fibroid. You know that you have tumor sitting at the right place that your baby is supposed to sit. You ignore it. You become pregnant. Now, this your baby is going to fight with the tumor. Whichever that wins, if the tumor pushes your baby away, you have miscarriage. If you have infection, you have miscarriage. Even if the infections allow the baby to stay, during the treatment of the infection, they will remove the pregnancy. So, I believe I've spoken at length. Thank you so much. If it is your first time, I give you a hug. Please like and follow our page, share our videos. You can support me if only you like what I am doing by subscribing to my page. Share this page, recommend the page, review the page, do whatever you want to do with the page, and God will bless you. Until I come your way again, I love you all. Take it.